Excellencies, colleagues and friends, thank you for inviting me to address you today. I know that Colombia is working hard to respond to COVID-19. That means much personal sacrifice, major disruptions to the economy and business, and a profound strain on the social fabric. WHO and PAHO in your region are proud to stand shoulder to shoulder with the government and people of Colombia in its efforts to bring the virus under control and continue providing essential health services. More than 522,000 cases of COVID-19 have now been reported from Colombia, and more than 16,500 people have lost their lives. But no matter how difficult things may seem, we know that it's never too late to turn this pandemic around. We have seen many countries bring this virus under control. I would like to recognize the work of President Iván Duque and the government of Colombia for leading this national effort. National unity and regional and global solidarity have never been more important. We're working hard on coordinating the global effort to develop medical tools to end this pandemic. But as new diagnostics, medicines, and vaccines become available, it's critical that countries don't repeat the mistakes made early on in the response when some countries hoarded supplies. We must recognize vaccines as a global public good. Through the Access to COVID-19 Tools Accelerator and the COVAX Global Vaccines Facility, WHO is working to support equitable access. It's vital for governments, the private sector, and civil society to join forces and work together to achieve the goal of equitable access to vaccines, particularly for our health workers who keep us safe and the elderly and other vulnerable groups among us. We must also recognize that the pandemic has many impacts beyond the disease itself, disrupting essential services for other life-threatening illnesses such as cancer and hypertension. Critical immunization programs have also been suspended, putting tens of millions of children at risk. The so-called lockdown measures that many countries have instituted may have unintended consequences for lives and livelihoods, including exacerbating hunger. And while COVID-19 is a global health crisis, its impact goes far beyond the health sector, causing economic, political, and societal disruption. The International Monetary Fund predicts that the global economy will contract by 4.9% this year. Within your region, the Economic Commission for Latin America and the Caribbean projects a 9.1% decline in gross domestic product, while trade in Latin America and the Caribbean will shrink by almost a quarter in 2020. We know that many businesses have been profoundly affected, but we also need the private sector to play its role, both in responding to the pandemic and in the recovery. This is not a job for the health sector alone. It requires a whole of society, whole of government response. WHO recognized that achieving equitable access to services, affordability, and fairness cannot be achieved without robust engagement with the private sector, which provides a significant share of healthcare services, research and development, and production. The private sector has played and continues to play a vital role in the COVID-19 response. I have been impressed by the way many nations and entrepreneurs have redirected industrial capacity to produce personal protective equipment and other commodities such as ventilators. Local production is not only a way to ensure a more reliable supply of life-saving products, it also contributes to economic development. COVID-19 is only one threat that people of Colombia and the people of the world face on a daily basis. Although our efforts are rightly focused on responding to this crisis, we must also learn the lesson it's teaching us, that health is not a luxury item or a reward for development. Health is the foundation of development and a cornerstone of economic, social, and political stability. But it's more than that. WHO was founded 72 years ago on the conviction that health is a right for all people, not a privilege for those who can afford it. The best way to secure that right for all people is universal health coverage, so that all people receive the health services they need without facing financial hardship. That is WHO's top priority, and it is the aspiration of all countries in the Sustainable Development Goals. Achieving universal health coverage requires investment in resilient health systems, especially in strong primary health care, with an emphasis on promoting health and preventing disease. Ultimately, strong health systems are the best defense against every health emergency, from the personal crisis of a heart attack to a global pandemic. Health systems and health security are two sides of the same coin. Let me leave you with a few requests to you as business leaders. The first and highest priority is to protect your staff and stakeholders, including your service providers, clients, and the communities in which you operate. Second, we ask those of you with local production capacity for vaccines and therapeutics to be ready to rapidly scale up production to ensure access. Third, you can support the response with in-kind contributions and financially through the Global Solidarity Response Fund or regionally to PAHO. And fourth, we ask you to advocate for the two most important ingredients in the response: national unity and global solidarity. Your voices at the national level, regionally and globally, are very important. We're all in this together, and we can only defeat this pandemic together. Once again, thank you all for your commitment and support. WHO has been greatly encouraged and humbled by the support we have received so far from many private sector partners. Your partnership is essential, not only for defeating this pandemic, but for building the healthier, safer, and fairer world we all want. I thank you. Muchas gracias.